Hello, and welcome to episode 12 of our University of Lynchburg Pulse of the PA podcast. Today, the University of Lynchburg Doctor of Medical Science program is really excited to welcome Dr. Amanda Miller, a 2020 alumna, PA consultant, actress, and model. Dr. Miller, thank you for being here with us today. Would you kindly tell our viewers about yourself and your career path as a PA?
Hey everybody, thank you so much for having me. This is such an honor to kind of be back in the alma mater and talking with some of the people that I love the most and have really shaped my career as a PA. So you want to tell me about tell you about my career as a PA? That's wild. Okay.
Yes.
We'll start by saying I did undergrad at Baylor in Texas, and then I went to Eastern Virginia Medical School for my MPA, and then did the DMSc program through Lynchburg. And it's definitely not been a straight path for me. I was kind of a career changer, so started a little bit later on. Initially started in cardiothoracic surgery as a PA at the University of Virginia, did that for a few years. Then I started doing trauma and acute care surgery, and that's kind of where I've landed in between the two since then. And just have really enjoyed the ride. I've kind of found ways to intersect all the things that I love about life while still practicing clinically and doing consulting work on the side as well. And just thoroughly enjoy being a PA and the opportunities that it's given me.
That's wonderful. Could you explain or expand on how you got into the medical consulting industry and a little bit about your medical consulting business?
Sure. When I was a PA student, I was actually the first female to ever be student body president of our PA program. And then I was the first female and first non-MD student to be student body president overall at Eastern Virginia Medical School. And so through that experience, I learned a lot about leadership, about what a PA can bring to the table in a healthcare setting, especially a multidimensional setting. And as we know, that's where all of healthcare is going now. It's very interdisciplinary, very team approached. And so I saw skill sets that we in our profession could bring. So initially, as a brand new grad PA starting out in my first job, I definitely pumped the brakes a minute because I wanted to really practice clinically well. That was very important to me, was to understand and have a solid foundation as a PA. No, the first day, I feel like when you're a PA, you're just like, I don't even know where the bathroom is, at my new place. And so it was really important to me to have the clinical foundation set. And after I got my feet there, I recognized there's an opportunity to educate others on how to be a leader, how to get a seat at the table. And that was actually a strong proponent for me going back and doing the DMSc program, was to further that skill set and to see how I could maximize it in more of a business infrastructure way as a PA. And so with my trauma and acute care surgery job, I started actually going and helping develop trauma and acute care surgery PA and NP programs around the country. So I ended up not just practicing clinically and helping fill a schedule, but having to do a lot of meeting CEOs, executives, and kind of merging the business aspect of medicine with the clinical side. And that's when I thought, okay, this is an awesome opportunity to be able to educate others. And so as I have migrated a little bit away from clinical practice as much now I really enjoy consulting others on how they can develop their PA programs, how they can develop, and not just PA, but APP as a whole in the clinical setting, how to work on maximizing revenue while not compromising patient care is very important to me. And so, yeah, I work with hospital systems and individuals who are looking to just better their program and from a leadership aspect. But I also help people who are looking for non-traditional roles in medicine. There's many PAs who were not just, I hate it when people say, oh, I'm just a PA. No, you're not just a PA. You're so much more than that. And so I also help individuals find other avenues within in and outside of medicine that they can use their PA experience to expand upon their career.
Wow, that's truly inspiring. And how would you say you kind of broke through into that medical consulting business? Is it, or even just medical consulting in general, is it something that you had one success at the organization
Sure.
that you practice at, or was it I have a solid interest in this, I'm going to connect with somebody I know that's already doing it? Or is there any advice for our viewers who may have interest in
Sure.
breaking into the
Um, uh,
consulting industry?
yeah, a lot of it was really just me seeing that there's a need for this type of service
Mm-hmm.
and recognizing that there wasn't one out there. So I created my own LLC and started the business myself. Uh, I did pay my dues in that, I worked for a few other companies in that leadership position, either as a lead PA, as a business development kind of individual for them prior to starting my own company. So I had worked with a few individuals before saying, okay, I don't want to necessarily work for another company now, but I think that there's a space for myself as a PA to be the owner of the business entity and then help others along the way. But I definitely started out, working for other people in that capacity.
Very neat, very neat. And that is really inspiring that you can, take what you've learned, you know,
Yeah.
surround yourself with
I
leaders
didn't
in
know
that
it
industry.
existed. Yeah,
Yeah.
when I was a PA, I think we graduated and many of us are like, okay, where's the, either the clinic job or the hospital job that I'm going to get? And we're so focused on just the clinical skills that we can provide to the PA profession, which, and like I just said before, that's so important to have that foundation because that's everything, right? But I didn't
Yes.
even know what we could do as a PA, all of the other various areas where we can tap into life and be of service to individuals outside of the clinic walls. And so that to me was just a game changer when I realized that no, I can marry the business side of the profession that I love with the clinical side and with the side of helping other APPs along the way.
Absolutely. What leadership skills would you say are essential in your role or your roles?
Mm. I think it's always an interesting question for me because it's a conglomerate. I think that kind of
Mhm.
makes up an individual. Listening is a big one. I think it's very important to hear other people out and not just fake hear them out. But
Mhm.
I often try to be the last one to talk in a room, and the reason is I want to hear what other people have to say. I want them to feel like they're taking part. A lot of people just they want to feel heard and they want to feel appreciated. Excuse me. And so if you can provide that to them, then people are willing to open up. A lot of people want to this is not necessarily proper English, but do good. People want to
Mhm.
do good and do
Absolutely.
well. And so it's empowering them to find that in themselves and then appreciation, whether it's, this just happened to me the other day. I was working in St. Louis for a hospital doing trauma surgery. And the trauma team sent a business card, wrote on the back, Amanda, thank you so much for all that you're doing for our program, and stuck a Twix on it. The simplest
Oh,
thing in the world, but it absolutely made my day. It's just it's a sign of just gratitude and appreciation for individuals in the room, and I really try and do that as a leader to others around me. I want them to feel heard and valued but appreciated because this job is hard.
absolutely. Yes. Those little things truly matter. It doesn't have to be this
Yeah.
big, grandiose, gesture. Those little things truly
Hmm.
matter.
And I'll say, one of the hardest parts for me that I had to learn as a leader was allowing others to help. And
Hmm.
as I've become into this, more so and had a lot of other career opportunities, allowing others. It's not allowing others to be collaborative because I've always been that way, but recognizing my limits and when I maybe need to pass something off or I'm super type A. I like to get it done. I know that I'm going to get it done and be efficient with it, but it's having to trust other people and allow others an opportunity to take on something so that we can maximize efficiency. Not always
Absolutely.
easy, but I try.
It is. It's not always easy, but it's so true. And when you trust, when you can trust, and when your colleagues know that you trust them and they trust you, and you're empowering others, like it just makes, like you said, it makes the efficiency exceptional, the team
Yeah.
culture, dynamic, so successful.
Mhm.
So I agree.
Absolutely.
I would like to transition and talk about your acting career and your modeling career and how being a PA perhaps shaped that career or how you ended up getting into that career space as well.
It's very interesting. I was concerned for a long time that I couldn't be both.
Okay.
And I initially did some theater and modeling prior to PA school. Then I got into PA school, was exceptionally focused in that realm, and kind of wondered, am I ever going to be able to do this again? Am I going to be able to do both? They're obviously vastly different, but in some ways exceptionally similar, which has been really fun to find out. And so it was something that I always wanted to get back into, but I think early on in my career, even pre PA, I didn't believe enough in myself as a person. I didn't believe that I could actually be in film and be in TV, and I loved it. I did some broadcasting and broadcast journalism prior to PA school, but never kind of made the leap. And with maturity and growth, you sometimes get to a point where you say, heck yeah, I can do this and I'm going to do this. And PA school definitely built that confidence. I mean, shoot, if you can get through PA school, you can sit for the bands and you can do all that stuff. It instills a lot of confidence that overflows into other areas of your life.
100% agree with that
Yeah,
statement. Yes.
for sure. So once I realized I did that, I just got to a point where I said, you know what, now's the time. Now's the time to take the leap of faith and just give it a shot. And what's so beautiful about being a PA that has afforded me this opportunity is that if Hollywood's crazy. They could literally say one day, we don't like people with blonde hair, and then I don't have a job, right? But I have a wonderful, wonderful base career that can still provide for me. And that's something that not often actors or actresses have in the industry. And I think everything happens for a reason and time. And so being a PA has helped me have stability to be able to pursue other things that I'm interested in. So it's kind of where, the decision to take up, people are like, why did you all of a sudden leave, being a PA to be an actress? It's been a very thought out process for me, and something that I was very conscientious about. Now, where does PA come into the acting world? Shockingly, a lot. So everything from, I've been on set for shows like The Resident, which is on Fox, a medical drama, and I look around the room and I'm terrified because no, this would not be the OR. No, this is not how we would do things. So that's been really fun. Medical dramas are the hardest for me to play because I'm actually used to not being emotional in those settings, especially in an operating room scene or, a trauma scene. So I've actually had to work quite hard to express my emotions more in the acting world in a medical scene. Now, the medical terminology, got that down, which is really, it's actually deemed a skill set in the acting industry
Wow.
if you can do medical terminology. So that's fun.
Yeah, I guess that makes sense. Yeah.
Yeah, because for us it just rolls off the tongue. For other individuals, they have to spend time reading scripts and practicing how to enunciate those words. I mean, you remember how it was when we started out in this world. It's like learning a foreign language, right?
Yeah.
And it just comes second nature to us now, but to other individuals, not necessarily. So yeah, it's been a really cool way to kind of show some of the medical skill sets within the acting and film industry. But when I compare the two, team dynamics is the biggest one that I see in the hospital. It's not just myself as the APP provider, but there's tons of other individuals I'm interacting with, and set is the exact same way. So there's hair and makeup, there's set, there's costumes, there's production, directors, producers. It's all very similar to kind of working a hospital shift day.
Interesting.
You know?
Yeah. I
Yeah,
mean, that analogy, it really makes sense, the team dynamics, and really also emphasizes why you have to have good leadership skills and be able to
absolutely.
collaborate and listen to others and make sure that you're letting everybody have a voice at the table too that needs that.
Absolutely, absolutely. Because we see all of the major celebrities when they film a movie and whatnot. And that's kind of what the general population sees. But when you're actually on set, there are hundreds and thousands of people that go into making a movie, not just, the star that we see on TV, right? So it's very similar in the medicine world as well.
Very, very interesting.
Yeah.
And I just love every role that you have taken on, because it really shows what our options as a PA can be, all the
Yeah,
opportunities.
and that's been fascinating in the film world to see how you can interject your medical career. So there are individuals that they hire to be on set to make sure that the devices or the way the room is laid out is appropriate. And some of them have been I've worked with a radiology tech who then transitioned to that in the entertainment industry. I've worked with a nurse who does that kind of on the side. There are people that they consult just to make sure that the way in which a script flows is how it would be in the real world for a medical drama. They have medics on set. I always love talking to the medics on set. Those are my favorite people, because they're usually either paramedics or many of them either want to go to PA school or are trying to find their way in the world of medicines. But they're always fun because they're dealing with, the actual medicine emergencies that happen on set. So it's always interesting to see what they're up to.
Very, very interesting.
Yeah.
Do you have any advice for our viewers or anybody thinking about pursuing a post-professional doctorate?
1000% do it. I think it's important to vet programs, to find programs that fit your needs. There's many different programs out there for different interests that you may have. For myself, and wanting to really merge the business side with healthcare, I found Lynchburg's program to be helpful for that. And not just the curriculum itself. One of the most challenging classes we did at Lynchburg was on law and ethics in my DMSc program. And I'm actually from a home of all attorneys. So my dad and my brother, and they practice like medical and medical malpractice attorneys. So that was actually really fun during the DMSc program, because they saw my thick textbooks like, oh, ha, 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 that's what I used in law school. But I say that to find a program that fits your needs. They can all be very, very different. Find a program that is going to challenge you. It's not just to get the piece of paper to then stick on your wall or to put on your resume. It's really just the start of your career when you obtain a doctorate. It's the jumping off platform. I looked for programs where I felt like I could make connections. I could work with and learn from other individuals around the country, tips and tricks, and just how to be not only just a better PA, but a better leader. And so it's not, I don't know, some people just think, oh, I'm just going to get it because then I can get a pay increase, or, I want to have more salary negotiations. It's so much more than that if you maximize the opportunities that come with the program.
Absolutely. Do you have any advice also for our viewers about getting into advocacy for our PA profession, as you've been a big proponent in advocacy for our profession, and also on the state and national level, as you've been very involved in our Virginia Academy of PAs organization?
Sure. And, when we talk about how my consulting business came about, and all of these little stepping stones led to being able to do that. Now, I wouldn't be able to consult and help develop an APP program in a hospital setting if I didn't have the experiences that I've had previously. So I think it's important to note that I used, even as a PA student, my experiences with VAPA, AAPA, and the Student Academy to grow as an individual, to learn about the infrastructure of the PA profession, like I said, not just clinically, but holistically. And so my advice is, no matter how big or small the involvement can be, get involved, because you will learn and you will grow from it. I'm now the only PA on the guidelines committee for the East Trauma Association, which is huge. I helped develop all of the practice management guidelines for trauma and acute care surgery around our country. And so to have that ability to influence from a research standpoint, from a didactic level, would not have happened had I not even did small roles. I remember at one point, even with BAPA, I thought, man, I would love to be on a bigger committee or to have a bigger part, but I just couldn't time wise. And so I reached out to one of my dear friends, Blake, and he said, well, why don't you just help me with some social media stuff? And I said, okay, sure. I love that. I love, I'm really active on Instagram and I love social media. And just even those connections allow me to continue to grow as a person and as a leader. And I said, look, man, I can only give you, maybe a couple hours here and there. One of my favorite things is hosting the Student Challenge Bowl with
Yep.
him. That's been
Yes.
such a blast to connect with just young, fresh minds, and they're super wicked smart, which is always humbling during
Yeah.
that process. But yeah, it doesn't have to be. I think we get lost in the sauce sometimes, thinking, oh, I have to have a big role, or I have to run for an office or run for. No, just get involved at any level.
Yes, that's wonderful advice because you it also opens doors that you may not even know are an opportunity at the time until, 6 months, a year, 2 years later. So,
Mhm. Or people recognize then skill sets that you can bring to the table to help, and that's where I say with social media. When I was helping Blake a lot with that, I wasn't really quite sure where I fit in at VAPA and how I could contribute, and he recognized that in me and then brought that to the table, where there really wasn't even something that was advertised. It was just like, oh hey, this is a way that you can contribute, and just developing those connections, just like meeting you and other individuals across the state and across the country to further our profession. I think it's very important for solidarity too for our
mhm.
profession. I look at our profession a lot like the acting profession in some ways, in that there's an organization called SAG, which is basically the writers or the actors union, and you have WAG, which is the writers union. And right now they're on strike, which is why I'm not filming as much right now, because we're not allowed to legally.
Mhm.
And I think about the solidarity that the actors and the writers have together right now. It's a small but mighty group, and that's the same way that I look at our PA profession and kind of the global overarching healthcare industry. Right, we might be smaller than some other professions in terms of numbers, but when we come collectively together, the the impact that can have, and not just on patient care but legislation and moving our profession forward, is phenomenal. And so we can't undervalue the little movements, that get us to where we want to
Absolutely.
be.
Absolutely. And then you see the success. Even the little movements are eventually going to create this success story, and we've seen the success story
Absolutely.
in our profession already, and we're continuing to move forward, and we're going to see more success stories. So
100%.
wonderful. Well, thank you so much for being here with us today. We really appreciate it,
Yeah.
Dr. Miller.
Yeah, thank you so much for having me. It's always great to reconnect and share. And I always say this to anyone: I'm an open door. If there's ways that I can help individuals, whether it be looking for some non-traditional roles to fit in your career as a PA outside of the clinic walls, whether it's clinically, whether school's really hard and you just need, something.
Oh,
I
here.
really enjoy talking with individuals in our profession, and so I'm always here to help where I can.
Thank you so much. We really appreciate all your advice, all your advocacy and outreach for us.